Welcome to the State of Health. I'm your host, Karen Bowling, Cabinet Secretary of the West Virginia Department of Health and Human Resources. If you're 65 or older or know someone who is, then stay with us. In today's show, we're going to take a look at issues affecting seniors in West Virginia and how the state can help. West Virginia's senior population, those over the age of 65, is projected to increase rapidly as the baby boomers reach retirement age. A 2012 report by the West Virginia Center on Budget and Policy projects by 2035, nearly 1 in 4 state residents will be over the age of 65. The most rapidly increasing group is seniors over the age of 85. So, it's no surprise the demands for this segment of the population are increasing. Joining me to talk about services for our most vulnerable seniors is Michelle Saxton with Children and Adult Services, which is under DHHR's Bureau for Children and Families. Michelle, thank you so much for being here.
Thank you for having me.
You know, we know that right now, currently, West Virginia has the third oldest population in the United States, which is really critical in terms of us ensuring that we have services for those seniors and for those adults. Can you tell me a little bit about what your programs do for adults in the state of West Virginia?
In Bureau of Children and Families, we serve the population of anyone over the age of 18 who has a mental or physical incapacity. And in some of those ways that we serve them are we offer assisted living, case management services, we offer adult family care, case management services. We also may be appointed as their decision maker either through the Healthcare Surrogate Act or through an illegal guardian. But I think what most people are familiar with our department is adult protective services. And under that certain category, we are tasked with protecting and we're tasked with investigating abuse or neglect of anyone over the age of 18. And also, too, during the processes of offering these services, we can connect them with other community resources that may be able to help them with their situation, because we always want them to remain independent and self-sufficient and in their home as long as possible. So those are the types of services that we offer through our program there at Bureau of Children and Families.
And I think it's important for our viewers to know that, you know, we at the Department of Health and Human Resources under the Bureau for Children and Families do have these programs. And, you know, a big part of our job is to make sure that, you know, our seniors are protected. And they are a vulnerable population.
Right.
So I think what individuals out there in the community need to know is if you think that there's someone at risk, if there's a need to report adult abuse or neglect, how do they go about doing it? And sort of tell the viewers a little bit about our process and how we ensure that adults are in a safe environment.
Well, anyone can make a referral. Well, that's what that's what we talk about. Anyone can make a referral about abuse or neglect allegations to our department through our centralized intake. It's a 24-hour number that you can call. It's 1-800-352-6513, and anyone's available at any point to take that information. They also will take information if someone is needing placement for in the adult family care program or through the assisted living. But mainly their main calls are for abuse and neglect. And anyone in the community, like I said, can make the referral, but we do have some mandated reporters. So it's people who come in contact with some of our seniors through, through doctors or their mental health professionals or through social workers, or even if you work at a facility, such as a nursing home facility or assisted living, you are a mandated reporter to call in those abuse or neglect allegations. So what happens with that process is once you make the call, someone will determine whether or not it meets the definition of abuse or neglect, and then it will be assigned to someone in that county office. And that county office will go out and check to see, and it may just be a simple referral once they go out. The senior may just need some information on how to get certain services so they can remain in their home. Because sometimes we go out and it's just for self-neglect. the person just may not be familiar on what these services are available or how they can get the information. So by us going out and making that initial contact with them, it's maybe opening other doors for them to get in the community and get the services they need for that particular reason we're out there.
And I think that's really important. I think, there are people out there that, are independently living but don't realize that there's help.
Right.
Whether it's through, the things that we do through the Bureau of Children and Families, or it's really community supports. There are people that want to help them and want to help provide them with a good environment so that they can live independently. I know, working in the healthcare industry, I'm a nurse practitioner, and that, sometimes we would come upon people who would come into our hospital and basically they just didn't have, the ability to make sure that, things got fixed in their house because they've lived by themselves for long, and now I'm 85 and I can't get out and do it myself. Do you see that happen very often where, there's just really not the resources out there because they don't know it, and there's ways that we can really facilitate helping, our seniors that are out there?
Yeah, because I feel like sometimes they may not have the ability to get out to find out those resources. They may not be on these social network type things. So just seeing our faces coming out and talking with them, and guiding them and finding those community resources will allow them, to remain in their home, to help themselves, because sometimes their family are not in the area, and we may be the only face that they see for a while. And I think that's comforting to know that they have that information, and that they can go and it's just maybe something as simple as that. So if you know someone who really need that extra guidance or their extra help, or you may want to help them, just give our office a call, and maybe we can send somebody out there to explain to them or to offer them the services that are available in their community.
I think another thing to point out is that, there's always a lot of emphasis on the importance of Child Protective Service, and I think it is critical. I mean, we all know that, we don't ever want to have children in danger, but we do have adults in danger, and I know that our staff works diligently out there in the DHHR offices to go out and to do assessments and to make sure that, individuals are safe. And if they're not, there are ways that we can ensure their safety, and there's things that we can do, and I think it is important for people to know that, and that our staff are very dedicated to that.
Right.
And I know you interact with our office staff on a regular basis, and it's a lot of very dedicated workers.
Right. It's just a matter of just hooking them up with those resources sometimes.
Now, I know that there's a particular emphasis on the Adult Family Care Program. Can you tell me about volunteering for that program, or how we could go about getting more people involved?
The Adult Family Care Program is a program that is certified and monitored through DHHR. What happens is, if someone is interested in doing, they call DHHR. And they say, hey, I want to become an adult family care provider. And you must be at least 21 years of age. But what happens is, once all that process is started, someone will come out to your home and they will evaluate your home to see if it's safe and if it needs anything additional to house people. But this allows someone that may need limited prompting, or that maybe just have some sort of physical or emotional need, and that may want to be in a family environment. This allows them to be a part of that family. They live in the home. The provider can house up to 3 people in their home, and the person will pay for their care. And if they're not able to pay for their care, the DHHR will supplement that payment for the provider. So it kind of is like, if they're living alone, they will have someone, that can help and assist them, and they can fill that family void.
And that's exciting to know that we have those kind of opportunities out there. If anyone's interested, call the Bureau of Children and Families under the Department of Health and Human Resources. Thank you, Michelle, for being with us.
Thank you very much.
Still to come, we'll take a look at how seniors can find help that will allow them to live as independently as possible. Stay with us.